Hi, my name is Haley Thompson, and I am one of the registered nurses at Connect Pediatrics. I became a nurse because I'd always been told by my mom how amazing her nurses were. I was a premature baby, so she spent a lot of time in the hospital, and she attributed a lot of the success and feeling comfortable to the nurses. They helped her breastfeed. They were around a lot more than the doctors. They were very hands-on, and I've always had a desire to help people. In high school, I took a class that got me certified as a nursing assistant. And from there, I just kind of fell in love with the role and knew that was all I ever wanted to do. So I did NICU for my entire career. Right out of school, I was fortunate enough to get a job there. Absolutely loved it. And then I started travel nursing, which was fantastic. I think it really sharpened my skills a lot. However, once I started school, getting my master's in nurse practitioner, I knew I needed a more flexible schedule, and I was hoping that I wouldn't have to be working nights anymore, but I could still be utilizing a lot of the skills that I did in the NICU. And so kind of after researching home health, I found it was really similar, but a little bit more flexible, not so high stress, and you still really get the benefits of things that I liked about the NICU, such as building relationships with the families that you're caring for, still communicating with the other nurses that also take care of the patient that you're looking after. So those were all things that I really liked. I still got to work with certain medications and still keep up on my skills, like working with G-tubes. So that was one of the big draws that brought me to Connect. My favorite thing would be definitely the relationships that you build with your patient and your families. One of the families that I take care of, I've built such a close bond with them. They will cook for me. They're always excited to see me, and vice versa. I just get so much out of my job, and I do really feel like I'm making such a difference. In the NICU, sometimes I felt like I couldn't focus all my attention on my patient because I had multiple patients, versus the thing that I love about Connect is you're just with one patient for the entire day. So you really can put all your time and energy into that patient and just make sure that they're being well cared for. Connect is, like I said, just really helping me still have a healthy balance between my social life, my work life, and being in school. So that's something that I really appreciate. I can pick up shifts when I kind of have a lighter week in school, and I can also move my shifts around and trade shifts with other nurses. And then on top of that, the major thing is just not having to work weekends. Weekends are a big thing for me. I like to go to church and spend time with my family, so I'm not forced to work a Sunday, 12-hour shift because of that. But I also can work around kind of the other nurses' schedules as well as the families. So I do like to, if one of the nurses can't work one shift, that I can always pick that up and just make sure that the family's getting coverage as they need it. Connect feels like such a family to me. When I first came in for my interview, I immediately felt welcomed. And from there, the communication has just been so key. I never feel like I'm on an island by myself. Yes, I am the only nurse in the home at the time. However, I know I have so many resources that I can reach out to. I've had already a couple instances where there's just a change in the patient's condition and I really need to get a hold of the clinical supervisor, and they're always available as soon as I call them. Same with everyone on the operations team. It has been great with either changing scheduling or reaching out to me with certain needs that the family needs, or if there's a family that needs coverage last minute, they'll ask if someone can pick up. And then on top of that, we have such a good, easy kind of schedule to follow. So Connect provides us with just a folder that has important contact information, how we're supposed to do our charting. I feel like it's very well laid out. I was a little bit nervous when I first came in dealing with a new charting system, since the charting system is different from hospitals. However, it's honestly easier than what hospitals use, and I feel like I can reach out to the doctors, and I can also, give them a call. It's easy to find their phone numbers in there if I need to get a hold of someone. My advice would definitely be, if you're a newer nurse, just shadow a more experienced nurse for a couple of shifts. I only had to shadow for one shift, but that's because I was pretty comfortable already in my role. So I think it's definitely beneficial, and Connect is so nice about giving you as many shifts as you need to be on orientation, and just make sure you're comfortable with the family as well as, your charting and your role and your assessment. The other thing to keep in mind is the families are a fantastic tool. These parents have been taking care of their kids since they were born. So most of them are very well educated on what their child needs. However, it is important to keep in mind the balance that you still are a medical professional, and when it comes down to it, you know what's best for the patient. The parents may be coming from like a little bit different of a perspective. So in the end, it's definitely a collaborative process, but it's also your call if you think there's an issue with some sort of care being dealt with the patient. My other advice would be that you just chart everything. That's the main thing that's taught in school. If there's any change in condition, communicate with your other nurses. That's a big thing, because it's not always like a hospital where you're going to hand off a report to someone. You might not see a nurse because you might be on Tuesday during the day and they might be on Wednesday during the day. So that's kind of a big thing, and just keeping in mind continuity of care is communicating with everyone, including the clinical supervisor, nurses, everyone involved in that patient's case.